Ladies and gentlemen, it's another Sunday for Fuck's Sakes with Dr. Carey.
Hello, people.
We talking birth control.
Get you some.
Birth control and self-control.
Ooh, self-control.
Mm-hmm.
I don't know that I like that. I mean, a little bit, but you know.
We're going to talk about it.
Okay. Yeah, you would think in 2025 that there wouldn't be much to talk about, but it is still a huge problem.
Thank you all for coming in for another episode for Fuck's Sakes with Dr. Carey. What say you?
I say the weather is cold outside, and you know we all going to be hanging out together on the insides, and you should probably be ready for that because ain't no time for kids unless you make that decision.
What? Undertone a little bit, Jeffrey. You said hanging in the inside?
I mean, it's cold outside, baby. This is cuffing season. People are shacking up. That's why there's all these babies, you know, being born and all
pretty
these
nice
Scorpios.
here. I thought it was pretty nice. Spent a lot of time outside. But you're saying cuffing season is the whole of winter. This is when the babies go down.
Yeah, so cuffing season in the northern hemisphere is when we start tipping away from the sun and the days are getting shorter and the nights are getting longer and it's getting chilly. And we just naturally start looking for our people to go shack up with. That's a very real thing. And then in springtime, everybody's like, get outside and take your shirt off. So that's different.
Okay.
Yeah.
Sounded like you have a lot of experience with this, huh?
Oh my God, just watch a college campus ever, right? Like the first day that it's
you're right.
51 degrees.
The quad is girls in bikinis on the quad, guys taking his shirt off. Like, it's still freezing, doggy.
All
it's
of a sudden,
outside.
the frisbees are out and
tacky sack.
Uh-huh.
Oh, lower your mic just a little bit. No, your physical mic. No. Yep. Just a little.
So cover your face. There we go. Well, we're talking birth control today. We got Jeffrey in the background. Say hello, Jeffrey.
What's up, everybody? Welcome to FFS with Dr. C.
And we got Jeffrey mic'd up this week.
Yes,
so yay for us.
Yes. Mic'd up. What's up, TikTok? We're live on TikTok too. Shout out to my wife on TikTok. My wife's always holding it down on TikTok.
Okay.
Where do we start? I want to start with birth control has gotten so complicated, and so it's come a long way. I just remember girls being on the pill back when I was in high school. You know, when they first got that menstrual cycle, their moms put them on the pill.
And there's many pills, correct, for birth control?
Oh,
I want to talk about that pill, though. I want to talk about the 1993 pill. Let's talk about that pill.
Not a ton has changed, honestly. Like, it's still usually a combination of estrogen and progesterone, and in different ratios. And yeah, you take it every day. Total pain in the ass.
Now, let me ask you a question. Back in that time, if you missed that one day, were you fucked off? Did you have to catch up some kind of how? Was it hold tight or what?
That's still the same. Like, if you miss one, you're supposed to take it pretty much.
Is your guys' mics on?
I turned mine on.
Lavaliers.
Make sure that they're on.
We might have had a little
not working on TikTok.
delay.
Might be a little delay. Are we in there now? We talking about birth control.
How about there, Kaylin? How about that?
We good?
All right, go on.
I think they turned out. They timed out. Yeah, so birth control pills are still a combination of estrogen and progesterone, and you're supposed to take them every day. Back in the day, you would take them for 28 days, and then you'd be off for 7 days to have your period, and you just do that. If you missed one, you were supposed to take it right away and then kind of double up and take your chances. Supposed to take it about the same time every day, which is really difficult, especially if you don't have a regular schedule like myself. Many people don't. And so it's a pain. And the other thing is 50% of the people who start taking the pill stop taking it within a year because of side effects.
And what are some of the side effects of the pill?
Oh my God. Mood changes, weight gain, acne, irregular periods because they're overriding what your ovaries are doing, and so they're fighting with each other. Nausea, breast tenderness, like when it isn't even your period, you're getting breast tenderness. Some people, it makes their moods better. Some people makes their moods worse. Some people get worse migraines and headaches. Some people, it helps with them. And then at the very end of the spectrum, it can cause clots where you don't want them in your legs, in your lungs. It can cause strokes. Yeah, the pill.
God damn.
And so the consequences can be dire, and God forbid you smoke while you take them, because it increases your likelihood of getting clots, strokes, heart disease. So yeah, there's a lot of drawbacks to taking the pill, but babies are also a drawback if you don't want them. So
they ain't got a risk of stroke for the guy not to have a baby, huh? It's rough.
Right. So definitely don't smoke with them.
Put Eric back up real quick. Show my boy Eric some love. Love FFC, Dr. Carey. We get to see Marcus. Yeah, whatever. Go away. Listen.
Stay for the squirminess.
It's coming. So from there, how has birth control evolved? Like, I remember girls taking a pill like in 93. That's when I was probably 15 or so, right? Mm-hmm. And that's when it kind of started for a lot of girls, and they would talk about the shit. And how have we grown from there? Tell me the history of birth control from that point.
Well, I mean, the first contraception practice at all was condoms from 300 years ago.
Good old lambskin.
They was using lambskin? I wonder who came up with the fucking idea to put a penis in a bag.
Probably from sausage. They made sausage first in the casing and figured out, hey, this shit might stop.
And probably some mother of 7 was like, you want to hit it again? You best try to do something about it.
So put this lambskin over your penis and put it up in me.
That's
I don't know if that's...
I'm finishing with the sausage stuffing. You go do your own thing.
That's probably imagine all the stuff that they tried prior to finding out what worked.
Yeah, because it's not like we had...
Who knows? Just napkin. a bunch of red tissue, thin paper cloth.
They never tried that shit. They never
Be
tried
surprised,
it.
bro.
How would you feel anything with a fucking napkin on your penis?
I don't know that they were even thinking that far ahead.
Man, they know what it felt like. So I know they use no damn napkins. Anyway, so around what time was this?
300 years ago was condoms. And then the first birth control pill was FDA approved in 1960. So that's what we've been doing since then. And they haven't really changed a whole lot, honestly. You can play with kind of the ratio and the strength of the estrogen and progesterone, but I mean, that's pretty much what we got. You can take progesterone only so that you don't mess with your estrogen if that seems to be causing side effects. It has a little bit lower efficacy, so it doesn't work quite as well. And what that does is actually change the mucus in your vagina and make your uterus a little less hospitable to sperm and embryos. So it doesn't work the same. You're still going to ovulate.
How different is it between each individual? Like, is there some birth control that like really help women, that like make them feel good and don't have all these side effects? And I know that it could change broadly, like when you go from one woman to the next on whether or not that pill will work. But is there any that like are helpful to you and so that don't come with all the negative side effects as much as?
Everybody is so incredibly different. It is a complete and utter crapshoot. And so I think that's why there's a 50% drop off after a year, because like you start it, that one's not working for 2 or 3 weeks. You try something else for a month or two, and then your migraines start kicking in. Well, we're not going to take that. You take something else and you're having
And this is the pill still. This is the pill still.
This is still the pill.
Fuck.
So it's weird because 50% of women between the ages of 15 and 50 are on the pill. But 50% of the people who start the pill drop off after a year and have to try something else. And so, I mean, that is a huge percentage of the population who's trying to take the pill, but half of them can't. And so they're trying lots of different things. Like, the IUD is definite. Like, it saw its heyday in the 70s when it was very first introduced, and it migrated and it caused all sorts of perforations. People were blowing up their uteruses, getting infections. It was not good.
So what does the IUD looks like?
So it looks like a little T. It looks like a little tiny T.
Yeah.
And it's maybe this big, and it's got some strings that hang out of your cervix. And so basically the gynecologist or the family practice person folds it down so it kind of looks like a little pencil. And you stick that through the uterus and let the strings hang out so that when you want to take it out, you can pull those. And then once it gets up in the uterus, the little wings deploy.
Okay. What happens to the string during sex? It's just there?
It's just there.
Okay.
Yeah. And so nobody can really feel it unless you are digging around for it. Sometimes they migrate up and you lose the strings and then you have to go fishing for it, which is not good. Okay. Insertion of the IUD, especially if you have not had babies through your vagina, is really painful because the cervix is an exit only route. And the only thing that gets through there is sperm, essentially. And so when you're putting, something even like a quarter the size of my pinky in there, it's really painful. And you can get a lot of bleeding and cramping for about 4 to 6 weeks after you get the IUD. That can be really unpleasant. But then you get to forget about it for like 5 to 7 years.
Oh, it stays up in there, huh?
Yeah, which can be rad.
Like, they don't move?
It's not supposed to move. It's supposed to be like if your uterus is like a wine goblet, it's just supposed to sit in the very bottom of the cup.
Can you hit it?
What do you mean, can you hit it?
Yeah, that little ring. If you hit that ring right, that thing will come out. You hit the ring right. What about the IUD?
I mean, it's supposed to sit. So your cervix, like if your uterus is like this, your cervix is the bottom, right? Mm-hmm. And so nothing's going through there except sperm. Okay. So I don't care how big you are not going.
I'm not saying I'm big at all. I'm just saying people. I'm
not saying even as small as you are.
There you go. Whatever. I'm just saying. I know that ring comes out
to those kings. Yeah. Oh yes, the rings go. So if your cervix is hanging down from your uterus, the ring goes around your cervix, and so it's outside of your uterus. And so yes, if you are having sexy time, you might just like throw a little donut onto his penis.
So
What's happening?
the IUD, what are all the variations of birth control that we have now?
So we have short acting, which is basically the birth control pill, right? You have to take it every day or it's not effective. The longer acting one are patches that you stick on your skin, just like for perimenopause and menopause. You can do that too.
How often do you change that?
I think those are usually weekly.
Okay.
Yeah. So they're a lot more convenient, but they come off or they stick to your shirt and you took it off and then you didn't realize. And 4 days later, you're like, fuck, I don't know when or where my patch got off to. And so there are some problems with the patches too, but they tend to work pretty well. The IUD, which again is like 5 to 7 years, if everything goes well with that. You can do the rings, which are also a week. I think some of them are also 3 weeks. So
you change them out every 1 to 3 weeks.
Yeah. So it depends on if you get the slowest acting ones. Depo, the shot is still a possibility that you can get, and that tends to last for 3 months.
I'm sorry.
DoorDash to you?
I'm sorry. Yeah. Oh my God.
I hope that's true.
Oh no. So the Michigan coach who got caught messing around on his wife and lost his job, he got caught because he ordered a plan B to his office to have sex with the girl. At the university.
Eric, think it through.
Yo, how stupid can you be?
Think it through.
We'll get back to that later.
Oh my God.
Oh my God, Eric, you're so stupid. Wrong show, Eric.
You know what though? Like, take care of your business. You should not be anywhere near anyone's gonads if you are that dumb. I can't even.
Oh my goodness. Anyway, so we have that IUD lasts for 7 years, ring 1 to 3 weeks, pill, standard,
daily,
and a shot. No, the Depo shot
is 3 months.
Every 3 months you go get a shot.
Yes, and you would think fabulous, but there's so many side effects with Depo that people tend to use it for like a couple years, and then they're like, my boobs are weird, my moods are weird, my headaches are worse, and I've gained 28 pounds. So fuck this, and they nix it.
Do you gain weight with all of it? What is the most? What is the most keep? Which one keeps your hormones the most balanced?
Probably the IUD, because the IUD, you can get an IUD that has no hormones at all, and it basically just makes your uterus inhospitable to sperm and embryos. Like,
okay,
the lining is different, the mucus is different, the sperm get up there and they're lost, and the egg doesn't know what to do, and they can't get together. And even if they figure it out, there's nowhere for them to make a little nest.
Making left turns.
And so, yeah, it's a mess. And so that one probably has the least amount of systemic issues. There are some IUDs that have like a little bit of a coating on them. And that's mostly for comfort and to try to limit the bleeding that you get from them.
What about cost? Like, what's cheaper versus more expensive? Which one?
Back to health insurance again.
Oh yeah, that's interesting. So the IUD is super expensive because it can be, because they last for 5 years, right? So if your insurance,
the procedures, like you're not having to take a pill.
Correct.
Like, also, you don't have to pay much of a maintenance fee either. They're not getting a whole lot of. It's a one-time fee kind of thing for a certain amount. It's like a lease deal on the thing, right?
Yeah. Yeah.
You're getting a lease.
As long as it goes well, it is a one-time procedure. But when those things go wrong, they go really, really, really wrong. And then you end up in the hospital and you might have surgery. And like your IUD that you just got 7 weeks ago, they might flush down the toilet because you can't handle it. And you know, you just paid whatever, $1,500 for this thing, and it's now a biohazard. So, but most of the time IUDs are really well tolerated, and they do really well, and they have less than a 1% failure rate, because it's, you know, you're up there and you just can totally let it go. It's fantastic.
First of all, I want to say salute to TikTok. We have Dr. Carrie on our show today, on her show today. She's in our studio. And Dr. Carrie, tell me your website.
I am Dr. Carrie FFS, for fuck's sake. And yeah, you can go to my website. You can browse the information. There's blogs there, and find out what we're up to. And maybe you want to make an appointment with me and talk about all this stuff. I do a lot of everything, but mostly doing hormones for all genders. Would love to talk to you about it.
For fuck's sakes.
Yeah.
Now listen, Jeffrey was talking about back in the day what people probably tried, and he said a fucking napkin. The guy put in stupid shit. Don't listen to Jeffrey, but Jeffrey
People
thinks,
are wild. Is all I'm saying.
I mean, we use
They're
sponges.
desperate, bro.
Sponges.
They use lambskin. You think they didn't try something that was not?
I don't know how
animal
we got.
skin?
I don't know how we got to the place they were like, a woman was like, "I'll let you put this lamb skin inside my body."
I mean,
boudin.
There wasn't a lot of. There
Just
probably
make
wasn't
them
a lot of showering and all
penis
that going on,
boudin.
anyways. Like
That's crazy.
we're talking 300 years ago.
Oh yeah, I
It's
mean,
a little
women have
grimy,
been
anyways.
trying
regardless.
to douche and like all sorts of things, trying to.
I think it's
Make it
kind of crazy that we have one particular type of contraceptive for men, just one, and then we have all these different things for women that make them go crazy, and it's unpredictable. You don't know what you're going to get, and then there's a dilemma, right? This thing might be working, but at the same time, you might be gaining weight. You might get a little fucking crazy here and there. So, and we have nothing.
That is correct. And frankly, the science that they did to even FDA approve the pill.
What we
a little
have is
bit
we
dicey.
have condoms that are changed to make it feel better. That's
Yes,
all
exactly.
we get, basically. They just change the condom over and over and over again.
We want to
to
make
get the
sure
next
you
best
guys
one.
are comfortable.
I was
having
gonna
sex.
go there. Like I ain't no simp, but at the same time, I just want to get into the. Yeah, there's a huge double standard because the men are running the show.
Yes.
So
and
why try? Why try? Get your shit together.
it is-
Take your ass in there and take that pill. Tell me when you're ready.
Yeah, that's right. Oh, and if there's an oops, you also get to take another pill, or you get to have a procedure, or whatever, and the guy doesn't have to do shit about it. Like maybe he'll pitch in $100. Sorry if that happened. Bye.
That plan B. So, what the fuck does the plan B do? Because that just seems like an instant flush or something, huh? Like that can't be feel good at all.
No, it causes a lot of cramping, a lot of bleeding, and so yeah, it's not innocuous.
Does it throw you into a menstrual cycle?
No, it's kind of different because the menstrual cycle definitely has like your estrogen leads up to it, and then you get these big spikes of estrogen and progesterone at the same time, and then the estrogen drops off, and that's why you slough your uterine lining, which is what a period is. Plan B kind of works in a little bit different. Like it makes this big spike without leading up to it, and that's why it's so painful because your uterus isn't ready to do that yet.
What's the timeline for Plan B?
Hours.
Hours?
I mean, you're supposed to take it within 72 hours of unprotected
Okay, yeah, that's
sex.
okay. Cool.
And make sure that you're not pregnant before you take it. Ugh. And so that's kind of the idea behind that. And then you're sick for days afterwards.
If not far, other countries have used lining, silk paper,
Linen.
Linen.
Really?
Silk paper?
How
Yeah,
the
bro. They're
fuck-
trying everything to get it off without having
Shit.
another Jebediah born.
Mhm.
Fucking Jeff,
That's
bro.
right.
Wow.
That's right.
We got enough people to fucking mow the farm. We don't need another.
Oh, for real. How many children do we need?
So
But-
how dangerous is it to use Plan B over and over and over and over and over again?
I don't necessarily think it's dangerous,
Oh, so you
except
just take
that
an abortion vitamin whenever they get done
Yeah,
with sex?
but it's since it's so soon, that it's not like you're not dealing with a full-on growing fetus in your body at that point, right? Like that's when the abortion.
yeah, it
comes
should
into
be
play.
like not
It's-
even a cluster of
Yeah,
cells.
yeah, it's not even collected yet, really.
Yeah, you're making it so that implantation isn't possible.
It's almost still the eggs and sperm.
Probably still swimming,
Yeah,
huh?
Or they may have just gotten together and found each other, but they have not
They're still
done
their
any
form and all
chromosomal
that,
dance. Yeah.
Okay.
I think the problem with taking it repeatedly is your body doesn't know how to cycle after that for a few months. Like, where were we in this? Like everything got screwed up.
How bad could it be if you took one back to back, like weekends? Is
Oh, I
that
can't
significant?
recommend that.
Oh
man.
man, that's
I think
done.
that
I'm just curious on like how like.
If homeboy get him to his office.
But if
then
you're taking
I'm telling
birth, you could take birth control every single day with the pill. Like how much is too much of Plan B?
I don't
For
think you'd
education
want
purposes.
to. I don't think you'd want to take it more than once every like 4 to 6 months, because again, like it's going to take your body and your ovaries and your uterus syncing up and getting back on your cycle to do it without breakthrough bleeding and cramping and pain.
So then, can you have your ovaries removed?
Sometimes you have to for different illnesses, usually like cancer and things like that.
Okay.
But
It's not ideal.
no, because then you're unable to make estrogen, progesterone, and testosterone for yourself.
Okay.
That's what the ovary, like your pituitary will be like, make all the stuff because there's nothing in the system and nobody's getting the message. And so then,
I mean, well, is there a difference with how the female body reacts versus like, let's say a 24-year-old lady taking Plan B versus a 60-year-old lady taking a Plan B who's past menopause and all that? Does that have any difference in it?
well, I mean, a 60-year-old isn't ovulating, right?
She's not getting pregnant, bro.
But what's happening to the body if that lady chooses? Oh, because she's not gonna have a baby, so she's not gonna need.
Yeah.
Oh, okay.
Once you're
Talking it
menopausal,
out,
you
you
don't.
talk it out,
Yeah,
you know?
you don't need
So
to worry
I
about
was gonna
that.
let you figure it out. I wasn't gonna mess with you at all.
I
I'm
got
like,
you.
in my
Yeah.
50s, I am
Learning, I'm
definitely
learning,
not worried
learning.
about unprotected sex
Learning.
for pregnancy, just STIs.
In your 50s?
That was actually a question
You don't
from
think-
TikTok. John from St. Louis was asking, so I figured I'd just
Okay.
read John's.
Salute to John. Hey, so in your 50s right now, you don't think you can have a baby?
I know I can't. I know I cannot.
You know for a fact you can't.
That is correct.
Okay.
Yeah. But there are women in their 50s who are still having periods.
Well, how do
And
you know when you can and can't? What's the cutoff when people be like, yo, you look, you out the game?
I haven't had a period for years.
Oh,
So I'm not spitting out eggs anymore.
that's when you know.
Mm-hmm.
Oh,
So supposedly, so the definition of menopause is you haven't had a period for a year, which is dumb because there are plenty of women who don't have a period for 8, 9, 10 months. And they're like, oh, it's happening. I'm done. And then they have one and then the clock starts all over again. And was that actually a period? Was it like your uterus in its last throes of, I just want to get rid of this stuff? Like, you don't really know. And we used to use that definition for treatment of menopausal symptoms. And we're now learning that's bullshit. Like, you're in perimenopause for like 8 to 12 years, and you can go ahead and treat your symptoms during that time so you don't feel like garbage, and to preserve your bones and to preserve your muscle mass and to improve your cardiovascular health. Like, there's all these things we were missing the boat on by like, oh, you had another period, so I guess we're going to wait another year. So we're not doing that anymore.
I don't know if this is my wife talking through me right now, but I just sat here and thought about we have controlled you guys' destiny for
Ever?
yeah.
Forever.
And it's
And
weird to think
there's
that,
more
in all
of us.
facets. It's not even just a sex.
but it's weird to think that you would make a decision.
women make less in the work field and all. It's everything.
All of it.
But this is a little deep though. You got to think about it. These men were creating
The woman
process
takes
for
our last
women
name
without
when we
even
get
asking them,
married.
probably. Huh?
The lady is supposed to take our last name when we get married.
Right?
Well, that's straight up
that's
property.
Just a foundation.
That's a property issue. But
It's everything.
yes, even before that was
Crazy.
the legal situation, which by the way is not in every country. Even before then, like way back when we were living in caves, it was still like women were dying in childbirth on the regular.
Right.
Men were not trying to abstain or help with that situation. They were like, good luck, babe. Hope it works out.
Well, I think
on the
those
shoulder.
guys were hunting and feeding everybody else that was alive. I would imagine they weren't just saying, "Huh, that sucks," and just sitting there. They're doing some shit to survive.
Wait,
They're cutting the fucking animal skin and making fur coats and shit.
They were, but like women were also making all the food, making all the clothing, taking care of all the babies, taking care of the sick and the ill and the men
The
who couldn't
roles
go
were
out and
really
hunt.
defined.
Yes,
then,
it was
for
really
sure.
defined. But yeah, like I don't think those people were
Making birth control?
busting out lambskin and seeing what they could do with a sea sponge.
No,
No,
not at
definitely
all.
not.
Yeah.
Not at all. They didn't think about that shit.
No.
I just heard from some friends of mine who, because being on your period and having a partner who does not want to have sex with you while you're on your period, which, by the way, juvenile bullshit. It's blood. Like, fuck off. Anyways. Are you gonna wah me?
Oh yeah, for
Mhm.
sure.
Yeah, I have no tolerance for that.
Let's talk about it.
So now there's like these barriers. There used to be cervical caps. I don't think people are using those much anymore, but now there's like diaphragms that you can use that you can just put in.
And it catches the blood.
And so that he doesn't have to deal with that. And frankly, you don't either. And so, but one of my friends was saying, like, I'm perimenopausal, I bleed a lot now, but I'm hornier than ever. And so I'm trying to figure out what to do because the little ring diaphragm thingies are not working for me. And so she's actually using natural sea sponges. And like several other women were like, oh my God, yes, please. That sounds amazing. And I'm like,
where the fuck you put that at? You put a sponge up there.
Yeah. Natural sea sponge.
You said a sea sponge, like a living organism.
No,
dried.
Oh, okay.
But like you treat it, you make sure
living at one point.
Yes. Just like a loofah or,
gotcha.
Any of those types of things. But I found that really fascinating. And I'm also glad I don't have to deal with that. But
don't just leave the subject. Like, how does this work? So it comes from the ocean?
Yeah.
So it's dried out. So they come in all shapes and sizes.
Is it soft?
If you treat it, yeah. So loofah is like they cure it and they dry it so that it's rough because you're trying to use it for exfoliation, but that's not how they are naturally. And so you can treat them so that they are soft. And then the guy probably isn't going to even notice, and you're going to soak up a lot more of the blood that potentially is happening.
And then you chuck it. That's just one and done with that.
Yeah.
I feel like you can just clean it.
What's a sponge? So you can just sponge it out again.
Yeah.
Oh, okay.
Uncomfortable?
I wouldn't think so.
During sex, it wouldn't be uncomfortable?
I don't think so. Because it's soft, it's spongy. And I mean, just like the actual sponge from Seinfeld, right? Those are supposed to be very well tolerated and comfy.
Let me ask you this question.
So then why not just a regular sponge?
I think because they don't soak up enough.
Well, if you would have sex on your period and the man were to wear a condom, wouldn't the blood get in the condom?
Where's your condom? I mean, there hardly any of it should get in there now. Like, because the condom should go hopefully down to the base of your penis. And then it's really tight, like that extra ring there. Or if you're using the lambskins, there's like a little draw tie. So no, blood shouldn't get in there. And frankly, even if it does, it's sterile and it's fine.
Oh, that's crazy.
Yeah, you can have sex while she's having a period. And frankly, we're super horny during that time.
Yeah,
so
I'm sure you can.
Win for everybody.
It's a mess.
Yeah.
I mean,
lay down your towels, people. Get your waterproof blankets out.
If you go to the shower, I think that takes care of a lot of it.
Oh yeah. Oh yeah, for sure. I'm just saying, like, it's a process that you have to have a lot of freedom to really have sex. You know what I'm saying? When you got a gang of kids running around, it's like, okay, we just can't lay this down and then jump up all bloody and shit. Kids walking on you looking like a fucking horror scene and shit. You know what I'm saying? Like, yeah, right? I don't mind it at all. My next cruise, Marcus, you want me to bring you back the sponge instead of the cigars? No, I keep the cigars coming, bro. I'm cool. I don't need no sponges, brother. When me and my wife get done with these kids, we're gonna have plenty period sex. Don't worry about it.
There you go.
Yeah.
Yeah.
So listen, let's talk about go back to the thing about these guys who've made these birth control situations for women over years. Where did that really start? Do you know the trials and how they started to get that shit together?
I think it came out of the science earlier last century that we're finally looking at menstruation and what happened with the hormones to even process that. And then they realized, like women are born with all of the eggs they're ever going to have. So if we can control the release of eggs, then we can control how many kids you're having, right? Like if you don't release the egg, then you're not going to have a kid. Birth control. So how do we do that? What was not taken into account, obviously, was that it's not just egg release. It is energy and mood and libido and autoimmune, like your immune system, your brain, like every single cell essentially in your body has a receptor for estrogen, progesterone, testosterone. So they didn't really think that through. And so, I mean, the good thing is that women were then able to take control to some extent over their reproduction, whereas before it was good luck to you, sister. So that part was good. I think the bad part was the science kind of stopped there, whereas it probably should have progressed into what are the other things that the pill is causing? What's the downfall, and how do we make that better? And so, you know, again, there have been more barrier methods with sponges and diaphragms and cervical caps and rings and like all of that kind of stuff.
Did that come before the pill?
No, since then. For like people who can't use the pill, it's like, oh, well, they still want to have some control over their reproduction. And for whatever reason, they're going to stop using the pill. So let's give them something else. So at least that kicked the ball off, right? There was a start to the whole situation. And the birth control pill, we have a lot more options so that you can change the dosing and see if that makes things better for you. But there still is no like pill for men. And there's a whole bunch of reasons why, but it's kind of funny because one of the main reasons why there's no pill for men is that it causes side effects and boys don't like it. And I'm like, really? Because there's a whole bunch of women who don't like it either. And still we do it to have some kind of control over it. So
before we go there, I just thought about like these women back in the day were having tons of kids back to back to back, staying pregnant for years, still fucking cleaning the house, fucking with the chickens, getting eggs. It was a real fucking deal back then.
Jeez.
What's the hormone responsible?
Once and two. I'm not my partner when my period is visiting.
It might actually be the drop in estrogen. And so in order to have your period, the estrogen has to drop so that your uterus left its lining. And that might make you feel feisty.
Is that a rise in testosterone?
Look, if you're in trouble, just blink right now, Jeff. You don't have to go home, bro. You don't. You're always welcome here, dog.
He's got a beanie and a glass of water. He'll be fine.
Goodness gracious. So yeah, so they never really, women probably never got a real input on the first beginning of this pill situation.
Not too much. I mean, you think of like the science, you know, what? Oh my God, 60 years ago, there weren't a whole lot of women involved with that in the first place. So, and there certainly weren't enough like on Capitol Hill and in the, you know, FDA and CDC to start fighting for, okay, that's a good beginning. Now we need some more ideas on how to make this better for everybody, because there's a whole bunch of women who are not going to take this because of side effects. So
do you think we need like a Kamala Harris in office to get that kind of going for women, like the science and all that? Like, God, because I'm being honest, like what president is going to make that charge to get stuff going on that, or it's all private?
We have women in the House. We have women in the Senate. We have lawmakers, I think.
But we have yet to have a female president, right? So like that's pretty significant.
Oh, so you're saying if we ever get a female president, will she take
like
all
how do
of
they
these?
ever get ahead?
Yeah.
You know, and that's what it seems like.
It's very grassroots, you know, and it is a lot of physicians who are supposed to be doing patient care who are then like, my patients are super unhappy, or we are harming them because there aren't enough ways and options to control your reproduction. And so it really, science and politics. But I mean, we just freaking gutted. That is correct. Those bitches in office right now want us pregnant. And that is one of the reasons I feel very strongly that the FDA, the NIH, the CDC, all of that stuff has been gutted. And now, oh, we'll give you $1,500 to have a baby. That is not even close to paying for prenatal care, and the kid isn't even here yet. So I don't even know what you're fucking talking about. And then you nix SNAP, and it's like, and WIC. And so all of the, you know, umbrellas and
that makes sense.
Support for after you have the baby, we don't give a shit about that. Oh, and we're not going to control guns. And so you can keep shooting kids on school campuses and in churches too. So like, I don't know why we're so bent on controlling women to have babies, but then zero support for when you're not a fetus. So as soon as you're out the chute, nobody gives a care. What? Like, why are there not more social services? Then people might be more interested in having kids. and taking care of them properly and
That's
getting
kinda
them
wild.
good
The fetus
nutrition and
feels like
education.
taken care of more than the person holding the fetus, or
Yeah,
It
nobody
was
gives a
little
shit
wild.
about mom.
It was a little
Nobody
wild
gives
to
a shit
think
about the
about.
kid. It's just the fetus. What is that? What even is that? You can't explain that to me. It doesn't make any sense.
I think Jeffrey had a good point there, though. If we had a woman president, she would definitely have to perform.
But like,
for
is that something that, yeah, they would? Is that something they'd run on versus like?
You can't run on that.
I know. First of all,
no, you definitely can't run on that. But fucking Trojan horse it, and then come in and be like, you know what? Let's start. We're starting trials. I'm signing a whatever to start trials
I
for
think the
men
problem,
to have
though,
appeal.
is you're only guaranteed 4 with the possibility of 8 years. So all of your time getting funding and all of that ready could be done in 4 years and then washed away to something else. That's
Well, and
the
you have
tough
to have
part
Congress
in-
on your side too, which
100%,
means that your
yeah.
constituents are supposed to be on your side. And
to keep it going for decades would be very difficult.
that's exactly what it takes too, because science has to move really slowly on this stuff. So you can't just like hop in with both feet and have everything done in 2.5 years.
It needs to be funding across the board, across parties.
Yes.
To really get.
Oh, and
the-
in our country, it has to make money.
Of course, that's
So.
the American way.
I think if you made a pill for men with testosterone, birth control, and some kind of energy, we would take the shit out of that. Yes, we would take that. Just all the feel good feelings. And Viagra. Add Viagra in there too.
I
Let me
was
see Alice.
please in my head. I was telepathically saying,
Yeah.
and sprinkle some Cialis
Yeah.
in there so that everybody feels good.
You would have no problem with men taking that pill.
And
If it
everybody's got a boner, and everybody's
call that
got
bitch
a
the
smile on
macho.
their
We
fa-
call it the macho. You take your macho today? I ain't missing a day without a macho. What?
Your swimmers can't swim, but everything else.
I think that's pretty
Uh-huh.
cool. I think if you want to trick us into doing the shit, tell us we're going to be stronger, better erection, not making babies. Oh,
Well, and that's the funny thing is because so female birth control works well because you're controlling a set amount of eggs, right? That's all you got. Sperm is made every single damn day.
Billions on trillions on.
Yes, every day. And so shutting down that production is extremely difficult because where do you do it in the cycle of things without ruining people's moods and boners and energy?
I mean, very low, right? And then to the point where we get a couple of days off, just like you do with the pill. We take a little while off as well, right?
Do you think that's going to fly?
Yeah, I'm telling you, I think that shit can work. The macho can work. You heard it here first. Dr. Carey, for fuck's sakes.
Okay.
The new man birth control is called the macho.
I mean, you could get snipped.
But
Let's
it has
talk
to be
about-
reversible.
Let's
That's a birth
talk
control.
about the snip.
That's a birth control.
It's a very good birth control. And
Explain to me the process of this, right? So if you are do you still ejaculate when you get snipped?
Yeah.
Does sperm still come out?
no, not sperm.
What comes out?
So sperm are just the little microscopic chromosome bags with tails. That's all they are. They're
Okay.
dumb as hell. Most of them have more than one tail. They're dumb as hell. And so, but so they're made in your testicles, and some of your ejaculate, the stuff like, the cum, the white stuff in there is made in your testicles.
That's semen for TikTok.
Yes. In your testicles, in your prostate, and in the tubes along the way. All of that is processed. And so just because you shut down the highway from the sperm to get into the ejaculate doesn't mean that you don't have ejaculate. So yes, you will still have jizz, cum, you will still have output, but there's no boys in there.
Okay.
There's no chromosome in there. And so that's another way that they're thinking about, instead of like cutting it and snipping it and burning it, you could put like a little cork in there. And so you're still making sperm. It just doesn't have access to the highway, right? And so they're actually playing with that over in Europe to see if they can do that, because then you can
what are
take the cork out.
consequences of that? Does it just continue to build and build and build? Like they're just keep on.
What would they do? Just
like,
do they die off?
Yeah.
Yeah, they die off, and your body's like, we have enough. Stop making those.
Okay.
We're good. But they just can't get on the freeway.
All right, let her in the room, Jeffrey. Put her comment up.
Wait, if female birth control had positive effects like you're offering, would be nice, right? Yeah, that's so
Call
real.
that the matcha.
Yeah.
Yeah.
And
Well, listen.
Don't take hers or his. Like, make sure you
don't think I wasn't. That was next.
Open the right.
I was trying to find a door for us first. I was just trying to find a door.
Always.
Okay. Man, you always got to flip it. If I get something at the doctor, she hopes it's worse. Oh, they went in my butt. Well, you know what they do to me? When I go, I'm like, what the fuck? How you want to compare this? I only have one hole. I have one hole.
How do you only have one hole?
Well, I'm saying that you can enter. That's the only hole you can.
I'm setting sail. You're on an island.
I'm like,
I was talking about my prostate exam, and my wife, when I came home trying to get some sympathy, she was like, fuck your prostate exam. You know what they do with my titties? They do this, they smash them. Yeah, she doesn't give a fuck. She really wants me to feel it. I'm telling you. I feel like that. The door for men has to be full of diamonds. Oh boy.
It's gonna be a long night for you.
It probably is. She's not gonna start reminding me either. Oh, so
I mean, we take the pill or we get the IUD or whatever, and there's no crown, there's no fuzzy slippers, there's nothing. Like, half the time they won't even give you a Valium to like get through the whole procedure, and it can be really, really awful. There's another one where you don't do this for birth control necessarily, but they light the inside of your uterus on fire. It's called an ablation.
Oh, okay.
Did you just spit something out? Because yeah. And I have plenty of friends that were not offered. They were like, you should probably take a couple Tylenol before you get in and get this done.
They will recommend you burning the inside of you before doing anything.
Jeffrey, it's electronic, Jeffrey. It's an
doesn't
electrical
matter.
burn,
They will
Jeffrey.
try everything outside of just giving man a condom. That's crazy. That's wild to me.
Usually it's because you're having funky
You're gonna have to stand on your head
bleeding
and
or
do
whatever.
jumping
We
jacks
have made
before
this very convenient for us, dog. Think about it. You're right.
Well, I didn't.
And zero
I'm guilty by
empathy.
association.
Zero empathy.
I had a homeboy
I
that
didn't do
keep
shit
playing
to
bees in his car. I had a homeboy that keep playing bees in his car, dog. Like, yo, what the fuck is this? Yeah, seeing a little jump tonight. Like, what?
Then you should have some, hopefully, magnums on you. What the fuck is wrong with you?
Hey, listen.
No.
Listen.
If somebody showed, I'd just be like, she ain't here. Click. Absolutely not.
Well, so how long do you think it will be to find us? But we were having a conversation the other day in our group chat, our conference call.
Thank you, Eric. That's what I was thinking.
You have 2 holes, Marcus. People can enter.
And actually, you have 3, because this is so pretty, too.
I just said I'm not gonna let nobody enter those holes with what I said, Jeffrey. None of them holes. No one's entering this hole, or that hole. For TikTok, for educational purposes.
These are choices that you make, but other people are not making those same choices.
For educational purposes.
Anyway, back to what I was saying. What
to
you? What do my wife have to say? People have to.
No pain meds at all. Suck it up.
Yeah.
That's right.
Okay. Left the lube in my butt crack and everything. Was disgusting.
Hey, he handed you a tissue.
He did. It was
Half
the way
the time
he handed
they're
it
like,
to me, like a
done
little
with us.
floozy.
Ba-ba.
Take that.
Mm-hmm.
Oh, man, I felt like a little floozy. He just walked out the room too.
Didn't even leave you a
it.
20?
He didn't say shit. He just handed me the tissue and walked out the room. I was like, yo, this is different. I'm definitely not used to this. Anywho, how long do you think it would take for us to get a trial going for something like that for men?
There are trials going on.
Right.
That for the past 30 years, they have been trialing a bunch of hormone stuff, things to basically, so the sperm doesn't have a tail or immobilizes it. So you're still making sperm, but they can't get to the egg.
They just swimming in the middle. They just hanging out in
Left
the way.
turn.
They're in the lazy river.
They're in the lazy river just
La 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 la.
They want to go somewhere, but they are not.
Mm-hmm. Yeah.
You
And
think
the
we ever
egg
gonna
is the
get out of here,
lifeguard.
dog? You think we ever gonna get out?
Have we seen this before? I feel like we've seen this before.
Man, they're gonna be in fucking sperm prison. It's crazy.
But then again, it has to be reversible, right? So you can't just give men something that immobilizes their sperm and walk away, because men are going to be like, well, what if I want to have a baby when I'm 68?
I think reversible for both sides is important. Like
it is.
Like that should be, there should be options for both.
Yes.
If you want to end it, like for good, go for it. If you want to have like something reversible, I think our technology should be.
So where do they go in and do that shit? Where do they go do the snip at? How they get to that?
For the vasectomy?
Yeah.
So like, if this is your sac and there's 2 testicles in the bottom, this would be like the midline. They make a little incision here and a little incision here, and they pull out the highway, your vas deferens, and they snip both sides of those so that they can't find each other, because they will try to knit back together. So you cut them so that they're too far apart. So hopefully the sperm will not find their way through. And they drop it back in there. They put tape on both sides, and you go home with a nice pack on your junk.
So, which is why you can still have a baby with that, because the sperm can make its way through. Like if the procedure's not done correctly, or. And
can I sue you if this shit doesn't? If I fuck it off, can I sue you as a doctor?
You are supposed to go back at a 6-week mark and jizz in a cup, and they look at it under a microscope and make sure that there's no sperm in there.
Okay.
Because again, you are still making.
But is that still guaranteed that just because that one ejaculation didn't have a sperm?
It's like over 99%.
Okay. How comfortable they make those rooms you got to jerk off in?
I don't know. I think somebody told me the other day that they were like, we need to have your cup within 10 minutes after ejaculating. And he was like,
well, the parking lot's illegal, minutes. Sir.
He's like, am I just supposed to go to my car? What? This is a private
They don't have rooms
situation.
for that?
I think plenty of offices do, but he just thought it was hilarious that he's like, I'm supposed to do this somewhere private and then drive 90 miles an hour. Yeah, exactly. Can I borrow the Ferrari to get back here with this?
No.
That made me laugh super hard. But I think most places are going to provide you with somewhere nice to do that.
Hope they give me a rundown on the room. Hope they give me the fucking jerk facts on that room. It should be like, okay, it's been cleaned and everything.
Here's your black light goggles. You can go in there and check it out yourself.
Like, yeah, let me know where it really goes down. Let me know where everybody's favorite spot is, so I don't pick that one. You know what I'm saying? I need the jerk facts on this room.
The fluffiest pillows,
exactly.
Like sit there. The most uncomfortable chair.
So
which I also think is hilarious, because like women were, having to hide to breastfeed and all of this stuff. And these are just nipples that every human has, and we're supposed to hide that. And now like you can go into the airports and stuff, and they have these little rooms. And I looked in there one time and almost started crying. I was like, I needed this so badly because it was not good.
They got the little shawls now.
Exactly.
Get up under
super cute. Yes, there's some nice options there. And like breastfeeding is not pleasurable, people. You get to go in and pleasure yourself. And then, they have a nice room with some magazines.
How did you
and
flip
probably
this? I thought we were going in the direction. Here you flipped it back.
Here, I'll bring it back. So we talked about the male vasectomy. What about the female side of things? How was that procedure done?
Oh, you get cut from basically pubic bone to pubic bone, like all the way open. They go in through your muscles. They push your intestines out of the way. They put like this hook on your uterus to make sure it's out of the way. So they have to move everything around. And then the highway is your fallopian tubes. So between your ovary and your uterus, and they cut both sides of those, burn each side. Because again, they don't want the highway open again. And then they have to sew everything back together and hope that you don't have a hernia.
Damn.
And that's under general anesthesia. So it is way, way, way
She made
riskier.
sure she explained that shit. This is so graphic. They put a hook on grab your fucking uterus. They tow truck your uterus.
It looks
How
like
much
a big
is it, though,
soup spoon.
So to get out of like the male versus female fight per se, how much is it just the biologies of our body are just more complex or not complex?
It's anatomy. It's just to get to the fallopian tubes, which are.
Well, does that make men just guilty then because we had to eat more simpler? Like,
No,
is that
not
our fault?
necessarily. I just think it's funny when men are like, it's not manly. I'm not getting snipped. And I'm
gotcha,
like, dude, it's a like 11-minute procedure for you. And you go home with a bag of ice where
Yeah,
she
see, this is
can't
wild.
lift
The
anything greater
comparisons are
than
just
a
so
hydro
crazy.
flask.
It's not even even.
I mean,
It's
listen,
not
even
even close.
the
And
door
it
for
is
men has
just-
to be filled with diamonds.
Yeah, that's crazy.
That's right. The room will look like a Jackson Pollock under a black light, Eric. Exactly. That's why we don't provide those glasses for you. You don't need that. You don't need to know.
Oh shit.
Man.
This is really this is a really crazy topic because now I'm realizing how fucked up this is. It is truly a fucked up process. You guys have had no input. Has a woman created any of these birth
Women
controls?
definitely like the
question.
newer diaphragms. I think the cervical cap as well. That did not do so well.
What about these? What about the ring, the IED, or any pill form, or any kind of birth control other than the put-ups?
I mean, the individual sciences or scientists, I'm not sure about that. I couldn't tell you.
Right.
But I know that it has been female driven to do the newer barrier methods like female condoms, the female diaphragms, things like that have been women driven. Like we can't take the birth control pill for XYZ reasons. And so we need something else.
Do you know if any female doctors are like leading anything in this research?
I don't know that actually. It's not my realm, and so I'm not
have a
being
team that would just send out an email and we're working on this shit.
I mean, if there are, that is what's happening,
I'm
and
sure
they are
there
super
is.
organized.
I would guess that I'm pretty sure.
But I think
do
it's
some
a
research and figure that out.
it's a funding problem, and so
Always, yeah.
if it's not going to make people money, then nobody's going to pay for it, and so the science just sits on someone's desk and doesn't get done.
Well, they want the babies and they want the vote, but
Yes.
you can't have them without the moms.
Yeah, it'll be interesting to
Maybe
see
they'll
how this
realize
evolves.
they'll make more money if they took care of the mom in the situation. More,
And that's so
maybe
true.
They would make more money.
Yes, like if you
Instead of
limited
just
how much
keeping
you
it
were
down, build it
spending
up
on
and see what that is.
Yeah. I mean, babies are freaking expensive as hell, and it's really cheap to avoid them. So let's do that. And then, the parents have actual options, viable options that don't make you feel like shit. So,
Well, let's talk about babies.
babies.
We were on our conference call Friday, and we have a teammate of ours, and she mentioned that a part of her package of joining onto this new magazine that she was going to work for, they offered her to freeze her eggs. She was like, "No, I want fucking money.
Yeah,
I want the extra money." They were like, "We have an option of freezing your eggs." She was like, "No, thank you." But that has become a thing in major executive positions.
Yes.
Not so much as like your nurse situation. I'm talking about executive situations to keep these women working and in place. And here's the thing. I think I was talking to my wife, and she was saying that women, when they have babies, they lose major time and ground in their field.
Mm-hmm.
And I never thought about that shit before.
Oh, it's massive. I mean, it's massive. Like if you are on like the trajectory of going to the C-suite or being the president or whatever you are on, and you're climbing that ladder and you take a jog to have a baby, all these other people are still on the
Promotions are flying all
escalator
around you, huh?
going straight past you. And then by the time you come back, and pregnancy does funny things with your brain too. And now you have completely different priorities because you've got a little one at home and you are mama lion. And so it is and usually in your profession, it's going to be in your 30s and 40s that you are on, the steepest part of that escalator to reach your goal, right? Well, that's when you're supposed to be spitting out kids too. Fuck, now what do we do? And so, yeah, I think that's exactly why women are freezing their eggs, because they want to make sure that they still have a really good option for when they are ready to have kids. But after the age of like 37, 38, your fertility goes down, your chromosomes might starting to get a little weird. And so you want younger eggs to have the best opportunity to have the healthiest kid.
Oh, that's why you do it.
Yeah.
Because you want the younger eggs, and that's why they're freezing them, huh?
You want the younger eggs. You want like your estrogen and progesterone to be, intact.
So if
when
companies are offering this as salary-based stuff, is it expensive to have done?
Yes, I was looking this up actually, and cryopreservation is what it's called because you're freezing the genetics. Is about 10 to 12 to 14,000 per cycle. And so
what's the cycle?
Menstrual cycle, because you have to like grab the
Damn.
eggs when they're getting released.
But so potentially once a month, is that how often you're having a menstrual cycle?
Well, it depends. I mean, because you're going to have to take meds to hyperovulate.
So to
like
do
you're
that,
not going to bother going in there to take 1 or 2 eggs.
Is there
you're
a reason why it doesn't work,
12 of
where
them.
you'd have to
Oh,
catch
shit.
another menstrual cycle? Like this, like the freezing didn't work?
Either the freezing didn't
Damn,
work
that-
or you didn't put out enough eggs. Because
That could be-
sometimes like and this is injections into your body like twice a day.
Wow, it would take a lot of money to make that happen, especially if you failed the first time.
Yeah, and then they put a big old long needle in
We're talking
through.
$28,000 potentially.
Probably
Yeah.
more than that. Possibly more than that.
Yeah, and time to save up that money potentially. That's crazy.
And then the nastiness of taking those meds twice a
So
day.
that's why they
for-
fucking offer that, huh?
Yeah, because it's really super. It's really important to people. It is getting into like, this is what I'm doing with my life. This is how I see my life, right? You're talking about someone's dreams and hopes and the way that they want their life and their progeny to function. But they're on the escalator to do something really amazing with their profession that they've been working for 10 or 15 years. And now you're at this like really tender part of your development of your career and your persona.
Gotta make a choice.
And you got to make a choice. And maybe because you've been working so hard and you've been in school and you're putting in all these hours, you ain't got a partner that you can count on at that point, right? And it's just not the right time in your life.
Damn it.
But you want to have the eggs that you want to have, and you want to do it at the right time. And so cryopreservation, just freezing them, is the best option, but it's going to be freaking expensive. And then once you get the eggs, you have to pay for them to be frozen. Like you don't just throw them in your kitchen.
What's the rental space on that shit?
Like $500 a year.
Oh, that's not bad.
It's not bad.
It's not bad.
It's not
I
bad.
thought you had to pay like $500 a month
No,
type deal.
no. You're
So then
just renting
when you're
space.
ready to have kids, what do you do with those eggs at that point?
So then you have to, this was so interesting and so American. Like, oh my God, we have to pay for like every freaking thing. So you pay for a thawing fee because this has to be done
for sure.
in the proper manner. And then you pay for IVF because you got to get you have not been pregnant yet. And so like your hormones aren't ready to receive this embryo. You haven't gone through all of the weeks of doing what needs to happen to make your uterus ready for this. And then you pay someone else for the embryo transfer to go into the little thawing area, put them into your uterus. And that's usually another $10K.
And then you got to get somebody to have sex with you, correct?
It depends. So you can just freeze your eggs and then you can have a sperm donor. I have several friends who have they literally like, let me just look through this catalog and.
Just find the dude in the book.
Yep.
Goddamn.
Damn.
Plenty of fish.
So, but and then they
Ew, no,
Crazy.
yuck.
they
That is wild.
inseminate it into your body.
Yes.
You have the pregnancy. So, but then is there an age limit to where you're freezing your eggs or it's cut off and you can't put them in anymore? You can't use them? Like,
I mean, you have to have your ovaries have to be functioning enough to carry the pregnancy
so
because
there's a potential you pay that money at 25 years old and don't ever use it later.
Yes.
Well, here's the thing too. But if you're an executive,
Damn.
me
Well,
ask
could
you
you
this
use
question.
it? Could you use it for someone that would carry for you?
yes,
Yes,
that's what
you
I'm
can
gonna
use
ask.
surrogate.
Okay.
Mhm.
Now, with a surrogate egg, you can use the man's sperm. Your husband, let's say you were married and you were too old. You got 50 and you still wanted a baby. Give it to a surrogate and use his egg. Would they fertilize it before they shoot it in her?
Yes.
Okay.
Yeah, because you can control what's happening in the petri dish a hell of a lot better than you can control what's happening in someone's uterus.
Okay.
So like you can go ghetto and do the turkey baster thing and just like put someone's sperm in there and say good luck, but it's just not it's not as controlled.
You think you would
And-
ever say that to your kid? You were born in a petri dish?
Sure, why not?
Fuck.
I have several people I can ask if they have told their kids that.
Damn.
But Yeah, I have friends.
Would you give a fuck? Would you give a fuck though?
I think it would depend on what your relationship is with your parent at that time. Like, are you going to use that as like a, hell yeah, we did, right on, or that's what's wrong with all of us?
Oh man,
right?
That is so true. If y'all had just been fucking, man, we would have been all right. You fucking got bipolar syndrome. I'm ADHD. He has a little pinky. Look at his fucking pinky, it's so little.
That's right.
We would have made in a fucking dish.
He was up against the wall.
That is crazy.
He's got that hump.
Oh my God. My wife says people treat you differently in the workforce.
When you're
a mother.
It's true. Yeah, that's very true too. I would have to say, so with my ER group, that was something that women asked every time they were coming in to interview for our group was, do you have mothers who are in this group, and how is that handled? Because there are some groups who are like, of course we have mothers. How's it handled? It's not. You just do whatever you want to. Good luck to you. And I have to say, like, my group kind of was like that. Like, there was no paid time off. There's no maternity leave. There's no, like, if you take the time off to go have a baby, that's on you. You will just have no income for those 3 or 4 months or whatever. So you better plan ahead. There's other groups where they're like, oh no, we'll put away money for you, and then you'll have maternity leave and you'll get this much money and blah, blah, blah. This is how long it is. And so, especially in medicine, again, like
super independent business kind of, huh?
Exactly. Those are very good questions to ask. And they would send, like, when women were being interviewed for that job, they would send the moms to go have dinner with those women so that we could talk about what our experiences were for pregnancy and having a baby and taking that time off.
Can I ask you a question real quick?
Yeah.
As a doctor, let's just say you join a practice and it's Dr. Jones's practice. Are you a independent contractor of that office, or are you?
It super
one
depends.
Of his?
So there's partnerships where everybody's the same-ish. And then there's employees where maybe not a doctor, but some kind of administrator is on top. And then you are an employee just like you'd be if you were wherever, Burger King. And then there's other places where there's a facility and you're an independent contractor and you just do whatever that contracted work is, and you get no benefits. You get nothing, like you're just on your own. And so, yeah, it really depends. And that's something, especially emergency physicians, because we're just kind of a weird breed the way we do things, because we don't need an office, right? We show up with our stethoscopes and a pen and the office is there. And it's not up to us to staff the emergency department or have all of the tools there and all of that stuff. It's up to the hospital. And so it's done in a lot of different ways, but typically, like, those are the three things. You're either a partner, an employee, or an independent contractor. And that's something you have to decide what you want as you're getting out of residency. There's a lot of pros and cons to all of it. Like, there are definitely moments where it was nice to punch in and punch out and not have anything to do with administration or paperwork or staff or anything. You just did your 12 hours and blew town. But then the group that I was in, we were a Democratic group. We owned ourselves. And so there was a lot of meetings and there was a lot of emails, but we also had some control over what was happening to our professions and our destinies.
This is a group of women.
It's a group of doctors.
Okay.
I think I was woman number 5 or 6 or something when I was hired. And now there's 20, which is fantastic.
I want to go back just a little bit to the sperm donor thing. That's becoming more and more common.
I think it's always been common, but I think it's less in the shadows, is what I would say. Like, people are, oh yeah, I do this thing. And it's lucrative. I mean, if you're going to be jacking off 3 days a week anyways, you might as well get paid for that.
Yeah, how lucrative is it for you
to buy yourself a couple dinners?
Me and Jeffrey trying to get out of our jobs. How lucrative is this?
I'm paying you more than if you were sperm donors.
I want to know all my babies. No.
You're getting paid more by doing this.
Okay.
But women can donate their eggs too. And that's actually
probably way more lucrative.
More lucrative because
see, now we have one. Yes. To my wife and Caitlin. You got one. There you go.
And it will potentially fuck up your body for the rest of your life.
Okay.
Yeah.
All right.
And it's not fun. Wah, wah, yeah. And it's not fun. Like when you guys get to make your deposit, there's a little bit of, ooh.
Oh man.
That felt really good.
You're right.
With us, we are.
They got to go digging. Huh? They got to
You
go
put
hook. They got to go hook the
needles.
service. They got to hook the cervix again.
No, but you have to basically do IVF. Like you have to do the twice a day shots exactly on time. It's messing with your hormones.
There was
and
a
all
poet
that
back
stuff.
in the day. He said, "Don't hate the player, hate the game."
I think we're comfortable hating both.
Oh, shit.
I think we're very comfortable with that across the board. Yeah. You're all going down together. Fuck you.
Oh, I don't have much more
Well
after
said,
that.
Dr. Carey.
God damn. Can we drop this mic on the floor? Listen, you got anything else?
Those were the major things that you gave me.
Shit. Well,
Yeah, it's rough.
I'm not putting myself through that. I'd rather
Donating the
just
eggs.
Yeah.
donate eggs. I'm sure they get paid big time for the shit though.
So
Don't
does
they,
surrogate,
Carrie?
though.
A couple $10,000, like $20,000, I think, for
Donating?
For donating eggs.
Same with the surrogate too. It's up there. I
Yeah,
believe.
and plus you get, I mean, they have to pay for all your
We
medical
get
care and
55
everything.
cents for busting a nut in the cup. Come on, man.
Why should you get anything?
Okay.
Mhm.
Whatever you say.
Oh, Jeff, you're not getting any tonight.
The comment. Who was it? Mine or his?
Eric said
Good.
$5,000 for eggs.
$5K for fucking eggs. But they probably have to pay for procedure as well, correct? Like all the shit you got to go through.
Oh yeah, for sure. And that's
Damn.
usually on the family that wants you to be a surrogate.
Well, for fuck's sakes, man. It's been an amazing show. This is Dr. Carey, for fuck's sakes. And give me your situation one more time before we get out of here.
Okay, my website is drcareyffs.com. There's blogs, there's funniness, there's like slinky pictures that you'll enjoy, and you can become my patient. I'm licensed in 15 states. I love to talk about all of it, especially hormones and sex. Come see me, send your friends.
We love you guys. Thank you.